This is self-care, part 1. Self-care is one of the most important aspects for the dental hygienist. In fact, it contrasts with the dentist, whose more focus is treatment and treating disease, whereas the hygienist is more preventative-based in trying to prevent diseases and provide primary preventative services. So self-care is super, super important. A lot goes into it. And basically, self-care and oral health education, all similar terms really describing the same thing. But oral health education is basically provided throughout your appointment and throughout your care with patients. During the assessment, you're assessing the patient's needs and figuring out what types of self-care instruction you'll be giving. You're going to form your diagnosis, which is going to help you plan for your intervention and preventative strategies. And then during the implementation phase is when you provide your education and your self-care. Okay, so it's kind of building, but the main bulk of your self-care instruction will happen during the implementation phase, so after your treatment plan. Okay, and you're always going to be ongoing evaluation with your patient and assessing any types of progressive changes. And of course, you're always documenting what you're recommending and your discussions with the patient. So like I said, during the assessment, you're trying to assess the patient's home care. It's super important to know what they're currently doing, the type of dexterity. Certainly you don't want to recommend a complicated toothbrush technique if the patient isn't able to demonstrate that types of dexterity. You want to make sure that you know what the patient's risk factors are and what types of diseases they're more at risk for, and select the appropriate preventative strategies for their risk. Okay, and you'll be utilizing your plaque control record as an indice to compare and contrast changes within the patient over time. You're also going to want to determine obstacles that may interfere with the patient learning or motivation. You're going to want to assess their willingness or readiness to learn. You're going to want to assess any type of cultural beliefs that may interfere or interact with any self-care strategies. And basically, it's extremely important to understand where their dental IQ is, what they know, what they don't know, in their compliance level, while being sympathetic and tactful. So you're going to assess a patient compliance. It's super important to have them demonstrate and show you what they do, because many times what we say isn't exactly what we do. So you can figure out a lot by just having the patient show you what they're doing. They could be doing a great job with their toothbrushing method, and you don't want to backtrack and show them maybe an easier technique if they have something that's more dexterous and more involved. So it's super important that you know where the patient is exactly at. And you want to see, are the deposits getting better or worse, or what is the gingival status, getting worse or better, because there's strong correlations with self-care and those evaluations. So you're comparing your plaque control record at every visit and comparing it. You're providing positive reinforcement and remediation when needed. It's super important when a patient does something positive that you make note of it and let them know and give them positive reinforcement. So many times hygienists are known for being naggy and always saying what they should be doing, to the patient, which can get, tiresome, and then they'll just block you out. So you always want to make sure that you're noticing any small steps that the patient's doing and make note of them and let them know. Motivation is huge. Okay, basically someone isn't going to practice and do any self-care if they don't value it. Okay, so not everybody is going to value dental health like you do. Okay, so it's super important to figure out what is valued by the patient and figure out if there's any discrepancies. Okay, education can be effective if the patient understands. So sometimes it's maybe you're not explaining what to do, but maybe trying to go back to figure out what their belief system is. Okay. The other thing is, a lot of times people will, kind of peer pressure, so to speak, or try and fit in a group. So it's like, if someone thinks their teeth look bad, it may be the aesthetics that gets them to provide good self-care as opposed to they want to hold on their teeth their whole life. So many people are concerned with the color or the brightness of their teeth more than the health or disease status of the teeth. And many times a good example of that is like teenagers, if they think that, a guy or a girl's going to like them if they brush their teeth, they may be more apt to do it. So, whatever works for motivation, and usually there's strong internal and external factors for motivation. So, principles of learning. Basically, in order to learn, you got to be ready to learn. Okay. For example, in dental hygiene, if you don't want to be here and you don't want to do this, I'm sure you're not learning as much as you could as someone who's interested in this and been wanting to do it for years. They're going to be ready and open to learning. Okay. And have the motivation as well. Okay. Many people transfer their learning, whatever they've thought. The new information needs to be somehow related to their previous experiences and related. Okay, so an individual is going to learn what is actually used. Okay, and you're always going to evaluate after your education. Now there's a theory in dental health education. It's called the learning ladder. It's tend to be used a lot in dental hygiene, but it's basically 6 steps. It's thought that there are 6 phases or 6 steps to acquire a habit. Okay, so it can be used in other health education things as well. But the first step is unawareness. So this is when a patient doesn't know about dental or periodontal infections and they're not really sure how they're prevented or controlled. Okay. The second step is an awareness. A patient has good knowledge of scientific facts, but they may not be able to apply it. Self-interest, the third step. This is when they're realizing that the science and that knowledge may apply to themselves. Involvement. This is when a response has occurred. Action. This is when a health goal is possible to attain. And the last phase is habit, and this is when it becomes part of a daily routine. Ultimate motivation is finally reached. Okay, so these are generally the 6 steps. Now what you want to do is think about your patients and think about where they might be on the learning ladder. And sometimes it can be too overwhelming if you're your patient's in the unawareness to get them to habit. Okay, but it's not such a big step maybe to bring them to awareness. So you maybe want to break things down. For example, if you saw the syllabus in the first day of class and you saw everything that you had to do for the semester, it's a little overwhelming. But if you just take each day, it's broken down into little pieces, it makes it more doable. Okay, so and the other thing too is people can be in different phases. For example, they may reach a habit with toothbrushing, but with flossing, they may not. They may be further below on the ladder and not really be as make the habit that they did with the toothbrushing. So just something to be mindful. They can different phases. So when you're teaching your patient, it's really important that you outline your strategies in the treatment plan and they've agreed to them. You've talked about it with your instructor in the beginning. And then once you've given your treatment plan and you're initiating your treatment, it always begins with self-care. That's what you do in the beginning of every visit. A lot of times students are anxious to get to calculus removal, dying to scale, and they want to jump in there and they make that the first thing they do. And unfortunately, that's not really what you want to do. First of all, you can scale all the calculus, and then if you aren't able to make progress with your patient, they're going to come back 6 months later. It's going to be all there, and you're going to do it all over again. And that's going to get tiresome. Okay? So what you want to do is focus on what the most important thing is with your patient, and that's education. So you want to start there. So if you're leaving it to the last 10 seconds of the appointment, oh, by the way, brush like this, do that, and then it's the last minute and you've given it the least amount of time and attention. It's when your patient is the most tired and dying to get out the door. So it's the least apt time that they're listening to you. So you want to start in the beginning of the appointment with the most important thing. Okay? You also want to think about the setting. It's tough because we have an open clinic and everybody's close, so you just want to be mindful of your voice, and you don't want to talk loud, and be respectful of your patient. You want to try to make sure they're as comfortable as possible. When you're talking to them about something, you want to make sure and sit their chair up and talk about it, okay? You also want to make sure that you demonstrate anything that you're recommending to the patient, and that they have time to practice, and make sure that they show that they're able to demonstrate what you've been showing them, and make sure that they have any questions. And then, of course, you're going to reevaluate and see how your recommendations have worked, and see what they liked, and what, if anything was hard for them, if they were successful. You also want to be age appropriate. There's a huge differences within a 4-year-old and an 18-year-old and a 80-year-old. So you want to just be really mindful, be age appropriate, and also consider the patient's preferences. Some people like to hear things, and some people will want them to show you. They'll want you to maybe draw a picture or use visual aids, or some people love the internet and looking things up. So you may know some great websites that you want to direct them to help them understand what their condition is and what they can do to improve their situation. You also want to think about the level of terminology that you're using. It tends to take a while to learn all this dental terminology, and then you quickly forget what it was like before you knew this. So you want to be really mindful of using terms that your patient is going to understand. Also be mindful of any cultural, linguistic issues. Sometimes you're going to need an interpreter. And you also want to be mindful of things like cost. If a patient's finances aren't great and you're recommending an electric toothbrush, you may overwhelm your patient. So make sure that your suggestions are appropriate and adapt to the patient. Okay? You're also, being aware of the motivational factors that exist with your patient. You may have to, your issue may be focusing on motivation. It may be education, it may be technique. You may have to involve the caregivers, and time may be spent with showing the caregiver toothbrush techniques. The approach is everything. It's super important that you make your patients feel comfortable, because if you're not likable and not sympathetic, they may not be apt to connect with them well, and they may not be comfortable with performing your recommendations. So really, how you talk to patients is one of the most important things. Okay, there's a technique called motivational interviewing, which is a newer concept which has been used in many different health education issues, but it's becoming much more prevalent within dental hygiene. Okay, so years ago it was basically, tell the patient, just talk to them, tell them what they need to do, and that's it. And they realize, that really doesn't work when you're trying to make changes with health behaviors. It's very complicated. So there's this technique, motivational interviewing, which is supposed to improve the chances of your patient being successful. So some of the key issues with motivational interviewing are listed. So you want to use a low-key feedback. Roll with resistance. So if patient's getting argumentative, you really want to avoid that. And kind of change the focus. It's important to be, supportive and warm, non-judgmental, and use a collaborative approach with your patient. Okay, you want to make sure and express empathy, and understanding, and develop any discrepancies. Help them see any discrepancies that they're that they believe in, and support self-efficacy. So you want to follow the patient's lead with their discussion instead of you structuring it and lecturing and kind of it going on your agenda. Really try and just have a conversation with the patient and see where it brings you. So a couple of the key questions that you're going to want to ask your patient is, how important is this to you? You know, how important is saving your teeth? How important is dental health to you? That will help. Instead of you trying to guess, just ask them. And of course, making an environment where they feel comfortable to give you their honest answer. You want to find out, how ready are they? So if you're talking about trying to floss every day, how ready are they? How confident are they that they'll be able to make this change? And ask them to use the readiness ruler. So 0 meaning not ready at all, and 10 being extremely ready. So you'll ask your patient, how ready are you to make this change? And then ask them, what would it take for them to move to a 10? Or if they're really low on the scale, like a 3, what would it take to move them to a 6? So you want to ask them what their commitment is, if it's okay for you to bring this up for your next time you see them, so that you're not invading their space and you're making sure they're comfortable, and it's more on the patient's terms than your terms. So some good MI questions are, what do you know about perio? Are you interested in learning more? What would make you more interested? Is there anything else you could do to improve? So you're asking them instead of telling them, lecturing them.